right, everyone. I like to do a little exam recap, and Tessie thought she'd help me with it. And overall rate, the average was 88%, which is a great average. And there were some people that got 100%, so it is possible. And find out who those people are and study with them. So I like to go over and do a most missed list. And usually what I'll do, what makes the most missed list is what any questions that I throw out, which I didn't throw out any this time, and any questions that more than 25% of the class missed. And there weren't very many of them. So overall, I think you did fantastic on the first exam. And also, I want to thank everybody for being on time for their appointments and really doing the tech part. So, for a lot of people, it's their first time doing it, and I appreciate that everybody stepped up and did great with that. So, I did not throw out any questions. So, my criteria for throwing out questions is if 60% or more of the class misses it, so only 30% or less gets it right, or 40% or less gets it right, then I throw out a question. And I take what I do is I compost it and I take the components of it and write a new and better question. But that didn't happen this time. So yay, you all did well on that, statistically speaking. So the most missed questions were where 25% or more of the class missed them were 8, 10, 13, 15, 22, 30, 31, 32, and 42, which is less than last year's class. So congratulations on beating last year's class. And I'll go through each one of those. So question 8, that was the one where you're rotating your head to check your blind spot. I know a lot of cars have backup cameras now and you don't have to do this, but even though my I don't drive that often, but my car has a backup camera, but I still turn around and check my blind spot, and I do it in the transverse plane through a vertical axis. So anytime you're rotating, and 63% of the class got this, you are rotating in a transverse plane through a vertical axis. I was surprised that 21% chose a vertical plane through a transverse axis because there is no vertical plane. There's sagittal, frontal, and transverse or horizontal. So anyway, 21% of the class chose that. I think that was just confusion on the wording, I'm going to guess. 8% of the class chose sagittal plane through a medial lateral axis, and that would be like flexion and extension movements. And 8% of the class chose frontal plane through an anterior posterior axis, and that would be like abduction movements. Tessie feels that I need to throw her toy. So I will throw that for her. That's what I get from sitting on the floor. So this is chapter 1, learning objective number 3, if you want to know where I got that question from. So question number 10, basically it was a definition of roll, spin, or slide, and the definition that it gave was one point along a rotating articular surface contacts multiple points on another articular surface. So it's like the car tires sliding on the ice. And so that's known as slide. 63% of the class chose the correct answer. 29% chose roll, which is multiple points on a rotating articulator surface contacting multiple points on another. And 8% of the class chose spin, which is 1 point to 1 point. This is chapter 1, learning objective 4. Question 13. This motion describes the translation of a bone away from the midline in a plane parallel to the ground. And the correct answer is protraction. 50% of the class chose the correct answer. This was the most missed question. I was a little bit surprised, but there you go. 25% chose pronation, which is not the right motion. Pronation is either pronation of the forearm, where the palms face forward or the palms face posteriorly or anteriorly for supination. 70% chose extension, and that's not it. And 8% chose supination, that's also not it. So this is in the area of osteokinematic movements. We practice these movements in lab, so hopefully I would like these words to become second nature to you at some point in time. So the this was another definition question. So I feel like a lot of the most missed questions were just definitions of things. But the branch of biomechanics that describes the motion of a body without regard to the forces that produce the motion. And kinematics is the correct answer. 75% of people got that. So that's good. This barely even made the most missed list. 20%, 21% of people said kinetics. And that is where you are thinking about the forces involved. And 4% said kinesiology, and well, that's everything. It's the whole thing. This is chapter 1, learning objective 1, which was a bunch of definitions. Question 22, the endosteum, and this is chapter 2, learning objective 5. So this is bone terminology, basically. So the endosteum is housing for the cells that are used in forming and repairing bone. So that's where the osteoclasts and the osteoblasts live. So the 75% of people got that, and 25% of people picked the membrane covering long bones, which is the periosteum, not to be confused with the endosteum. So peri is around. Periosteum is super important because it holds blood vessels for repairing bone. And it's the reason why bone heals well, because it has a good circulation, good blood supply. Question 30. Okay, Tessie, give me that toy. The basic contractile unit of muscle fiber. This is another one that's sort of a definition question, chapter 3, learning objective 4. And it's a sarcomere. A sarcomere is the basic contractile unit of muscle fiber. 75% of the class got that. 21% picked a myofibril, which is a few levels up. And 4% picked a fascicle, which is another level up. So just make sure, and nobody fell for cross-sectional area because that one's wrong, obviously. So just make sure you know what a sarcomere is, and make sure you know the relationship between sarcomeres, myofibrils, fascicles, muscle bellies. That will come up again in other classes. Question 31, the old active and passive insufficiency question. Most people got it. 71% of the class chose the correct answer. The critical word in this, and I even put it in capital letters just to indicate that it was the critical word, actively. Okay. So it's actively, when the hip joint is actively extended while the knee is in a flexed position. So we could automatically eliminate passive insufficiency of the rectus femoris and passive insufficiency of the hamstrings because it's actively extended. I hope I've got that message through to you. So 71% of the class got the correct answer. That's active insufficiency of the hamstrings. So the hamstrings are shortened over both joints in this active motion. If it were 15% of the class chose passive insufficiency of the hamstrings. In that case, so here we're in hip extension and knee flexion. If we wanted passive insufficiency of the hamstrings, we would have to be in hip flexion and knee extension. 8% of the class chose active insufficiency of the rectus femoris, and we would also have to be in hip flexion and knee extension for that. And 8% of the class chose passive insufficiency of the rectus femoris. If this were a passive movement, if she were holding onto her foot and pulling it up instead of using the hamstrings to actively flex the knee, then that would be the correct answer. But it's not. It's an active movement. It even said so right there in the question. So hopefully that makes sense. If it doesn't make sense to you, let's keep reviewing that. Active and passive insufficiency are going to keep coming up. And it's chapter 3, learning objective 1. And they're active and passive insufficiency learning objectives for other chapters as well. Chapter 9 being one of them, the hip chapter. So question 32, when a muscle contracts, what is the resulting movement? And this one was the second most missed. 54% of the class chose the correct answer. When a muscle moves, the least constrained segment moves. So if the distal segment is the least constrained, that's what moved, and it moves, and it's an open chain movement. If the 33% of the class chose the most distal segment. Well, it's not always the most distal segment. In an open chain movement, the most distal segment moves because it's the least constrained. But in a closed chain movement, the most proximal segment moves. 8% of the class chose that, and that's only the case when it's a closed chain movement. 4% of the class chose that the most constrained segment moves, and that doesn't really make sense. So we'll think about it. We'll talk about that when we're talking about osteokinematic strategies for the hip. And we'll talk about that on Tuesday in office hours if you want to. So this is another idea. It's around the idea of open chain, closed chain, chapter 1, learning objective 9. So just remember that when you move, the least constrained segment is going to move, no matter whether it's distal or proximal. If your distal segment is fixed, the proximal segment is less constrained, the least constrained segment is going to move. So question 42, it was the matching question that was the attributes of synovial joints, and overall people did well. There were a lot of mix-ups between articular cartilage and capsule ligaments in their functions. So this is the common elements of synovial joints. There's 7 of them, and the function of each one. And so the most mix-ups were between articular cartilage and the capsular ligaments. Articular cartilage absorbs compressive forces, so dissipates and absorbs compressive forces. Capsular ligaments limit excessive joint motions. So ligaments always limit excessive joint motions. That's their job. I always say they're the strapping tape of the body because they limit excessive joint motions. So stick that in your mind. And then when we're talking about the individual joints and we're talking about the functional aspect of the ligaments, we want to know what motions does it limit. So that's important. So remember that the capsular ligaments limit excessive joint motion. And there weren't as many misses on all the other ones. Those two got mixed up by a lot of people. So I hope that this was not a traumatic experience for you. Taking the test was. Let me know, and we'll see what we can do to de-traumatize the whole situation. So it is a different way of taking tests, and a lot of people have never done it before, that weird online proctored exam. But I think it works pretty well. And thank you all for being patient with me today because I didn't have my testing center helper. So it was just me doing all the check-ins, and I think everybody did really well on that part of it, and everybody did really well on the exam. So thanks a lot, you guys, and I will see you soon.